So it is, I can't believe it, it's the 9th graduate research day. And it's been growing. And the students have been growing, and every year we seem to have something new happening. And so it is really exciting to have all of you here. And I believe there will be a lot more posters going up because I don't see the named people who are here. I don't see them all here right now, it's a packed day today. And so first I want to thank Dr. Guerra, who I know has been keeping you all in shape with the doctoral students and the master students, and we even have a qualifying exam going on today, so no rest for the weary. so hopefully you guys are finding ways that things are getting better, and that you are finding being able to get your work done with more excitement and are looking forward to a better future. Today we, as you all know, every graduate research day, which many of you have attended before, we have a spirit day, and half a day is gone for doing something for your own empowerment, and it's not just talking and speaking, and it is it's supposed to be an active engagement activity. And so this morning we have brought in two wonderful people who you actually have met, probably one of them, and that is Mr. Bob Hacker, and then also with him is Daniela Cadena. And if you haven't picked up the book, you should pick up the book from outside because there's information about them. And you will be doing active hands-on learning. And the idea is, of course, that we know that not all of you are going to start companies, but we hope some of you will start companies. And you all know with Emerge Americas coming up recently, and just like Art Basel has become the thing in the whole of the country, Emerge America is for the STEM stuff, right? And so growing the ecosystem right here in Miami for medical device development, for medical pharma, for that is a mission for us as the primary public university for all of South Florida, right? So that is something that we can contribute to, and when I say we is you, because you guys are the ones who will grow that ecosystem and make sure that this ecosystem becomes stronger and stronger. And so part of what the hope is that things that you are doing in the labs, you are not only going to publish your papers, but you are also going to find ways to take that technology development or that research into into the marketplace to impact health. So you all know that it's real, but our hope is that we are giving you some opportunities to learn to do that. And so today is another one of those active learning things. And I'm sure they will tell you also about StartUP FIU. I won't tell you about it, and how you have a unique opportunity to have space within FIU to take your ideas to market. And we do know some people, like your very own Valentina, has made it as one of the awards and has been moving. We have to tell her you need to finish your PhD before you start. And then, of course, we will have the posters, and we know we have a thankful to all the starting PhD students. It's an early game for you, putting up your posters, ideas that are not quite formed. Maybe you'll end up doing that in your PhD, maybe not, but this is a great experience for you to put things up there. Master students who are putting up their projects that they may have already started or are planning to do, that's another good experience for you. Learn from communicating, figure out how you are getting information back and forth. And of course, there's always prizes. The department is not shy of prizes. And then the afternoon session of oral communication. So I think that should be, all of that should be a really good opportunity. It's an opportunity to learn, it's an opportunity to share, it's an opportunity for all of us to know what each other is doing. And then we have a fantastic speaker with us today. And so there'll be another introduction done then later. But what is special about the speaker is not just that he's a very accomplished speaker, but I think what is very special to me is that an undergraduate student came to my office and said, I would like to get Dr. Anastasia to come here. You know? And I'm like, there he is. You know? And he is the one. So,
It's his fault.
you know, it's his fault, you know. But then I put that, and then I talked to Dr. Daniela and said, he's the chair of the, you know, the review committee at the NIH for the imaging program. So, and then of course we know, you know, and you will have an opportunity to listen in the afternoon. But the reason I point this out is that, you know, we have the undergraduate research day. We will have that in the fall before PhD. But it is your department. It is your investment in your own education in the future. And it's everything from being able to invite speakers and having the ability to come up and knock on the chair's door and say, I want to bring this person in, to having this opportunity to share your research, dialogue, argue, comment, and it doesn't mean that everything doesn't have to be sterile, you know. You have to be able to debate, and you will have to do what is called a defense of your work, right? And you could be in Europe and standing in front of a true public community defending your work in front of that public against an opponent. That's some of the ways in which some of the European defenses are happening. We are tame compared to that. But this is an opportunity here for you to question each other as you are going around your posters and hone your own thinking. So have a great day, and we'll start off great. And then we have an announcement for a downloadable book.
So we will distribute a book to all participants. So whenever you have a chance, give your name and ID. Marian is coming. This is a book from lab to market, the process of commercialization, medical technology. And please just let us know if you're not interested, so that we share with other people. We have a lot of gel sanitizer and the faculty. So please, you're going to be crowded. So keep, the proper measure.
The book, by the way, is written by Elias Caro from the Coulter Foundation. And as you know, our lecture series and the graduate fellowships and all of these are possible because of our Coulter endowment. If you did not know about it, the department is a Coulter endowed department, and all of this is courtesy of that. But that book was recommended through the National Institute of Biomedical Imaging and Bioengineering, because they are using that as part of their STTR, SPIR mechanism, the way NIBLB is looking at applications that are coming into NIH for this technology transfer grants, is using the Coulter process. So we are very, very lucky that we actually have Coulter right down the corner from us to tap into, and that we have this. Okay? All right, have a great day.
Okay, so let's start the morning activity with Dr. Hacker and Professor FIU, with the director of the StartUP FIU, and Daniela Cadena as the director of venture rating. So enjoy and welcome them to your tour.
You want them to move around their tables or anything? To do that, you can do whatever you want with them.
Okay.
Whatever you want with them.
The way the agenda is organized is we're gonna talk a little bit about StartUP FIU. We're gonna talk a little bit about Fourth Industrial Revolution. Then we're gonna do a case. So I would suggest you're fine the way you are now. When we do the case, let's break up into teams of 4, socialize the solutions, come back together, we debrief. Okay? So thank you for the introduction. Thank you for the plug for entrepreneurship. Engineering school is a very high priority for StartUP FIU. And so it's always nice to be back here. How do I change slides? Okay, so why am I the director of StartUP FIU? Very good question. I built a $1 billion company in Indonesia Indonesia has a per capita income of $600 per person. So it was pretty challenging. I think some of you come from countries that are similar. After Indonesia, I came back to the United States. Eventually, I worked on a project at MIT in the media lab with Nicholas Negroponte. It was called One Laptop per Child. I was brought in because they could no longer survive as a donative organization. They needed to transition to selling laptops to governments to give them to the children. So my job was teach them how to sell laptops. And we basically doubled the number of laptops that we were distributing to children using fundamental entrepreneurship. And that was my first case of doing social entrepreneurship, which I think Danny's going to talk about in a couple of minutes. In 2016, I got involved with a woman named Emily Gresham, who works in ORED. She's an assistant vice president. She was charged with starting entrepreneurship at FIU. And I met her by luck. I said, I'm all in if you're serious. She was serious. And almost 5 years later, we've done 6 incubators at FIU. We've done an accelerator. We created a course in innovation for 5,000 students. And part of the reason that we've been so successful is that Danny was the 3rd person I hired. The first 3 people I hired were all my former undergraduate students. All right, and Danny was the 3rd one, and she's stayed the longest. So, explain to us why you're still here.
No pressure. A little bit about me and why I was there. Third employee. I was there for about 3 years. I left for some time to do grad school abroad, and I came back because I truly, first of all, I'm very grateful that I love what I do. I wake up every day and I really enjoy the work I do, and I think I'm very lucky for that. But it's because of what we're doing at the university. I think it's phenomenal to have a place where it's not housed under any academic unit, so we get to play with every academic unit, and that's where innovation really comes through. It's from different fields and different perspectives, and I get to work with students and researchers that come with wild, crazy ideas, and they're trying to solve some of the most complex problems, or they're trying to look at gaps in the market that sometimes the private sector neglects, and I think that's really exciting. That's really why I came back. And the team's pretty cool and quirky. So I am a proud FIU alum in the College of Business. I did pre-med for 2 years, wasn't my cup of tea. And so I switched into business, but I specialize in extreme poverty. So business models for people under the poverty line. And I worked here on social entrepreneurship and social business models. I really do a lot of my work in product development, and I specialize in vulnerable populations. I use frameworks like design thinking. I've spent some time at IDEO. I spent some time at Google, and I didn't really like it, which is why I ended up at StartUP. And yeah, for me, anything that has to do with the Sustainable Development Goals from the United Nations, it's a guiding star, because that for me are not just problems. For me, problems are opportunities in the market. If we're tackling that there's a need for 1 billion people that don't have access to safe drinking water, that's a market of opportunity for 1 billion people. They just have a different earnings, a different income. And so we just have to be creative in the way we think of solutions or marketing opportunities. And yeah, that's a little bit about me. I'll give it back to you.
The one thing that,
Stay there.
We're gonna put a microphone, so just give us a second.
On me.
okay,
Okay.
Just so that, especially the, if we are
Online.
broadcasting
Hello,
online.
online.
yes, we're pausing Facebook phone.
Bob, you're just gonna have to speak very loud because there's only one microphone.
I'll try. Tell me when I should restart.
Would you like a handheld mic?
No, this is a small room. We're good? Danny, advance one slide. So when you listen to Danny, you listen to me. One thing you should immediately take away is that Startup FIU is very comfortable in traditional entrepreneurship like a Google, or in social entrepreneurship like the project I worked on at One Laptop per Child. Part of the reason that I like BME is I think you guys are naturally in both camps. You could go either way. It's not up to me to tell you which way to go, but you could go either way, and that's attractive. Startup FIU has 3 principal objectives. Entrepreneurship runs through all 3, but the first is economic development, and they're not necessarily in order of priority, but economic development is to help minority businesses to grow. We have 3 different programs that focus on minority business owners. We take the concepts and principles of entrepreneurship, apply them to these small businesses. We produce what we think are quite good results around growth and job creation. Student entrepreneurship is what Danny runs, and this is for principally the undergraduate students. And like I said, we do traditional, we do social, we do a lot of experiential learning. And what we're going to do in the second half of the hour with you guys is an introduction to that. Research commercialization is what I spend most of my time on, which is how I met Valentina. And if you have any questions about me, you can ask Valentina, or if you prefer, you can go to Professor Gadavarti. She and I have worked together almost for 5 years. The first lecture we gave in the first accelerator, Professor Gadavarti, that's hard to say, I knew was in the cohort. And after the first lecture on opportunity, she came up to me and she said, I wish I had met you before I started my research. Okay? And I think the reason is she found it very interesting to combine her interest with commercial opportunity. Because there's an awful lot of people that have realized that the power of the market and the capital of the market allows you to take your social impact and achieve it at a much bigger scale. And that's, I think, what Anu saw in the lecture. So that's a thought to keep in mind. And I'm becoming a student of our visitors agency and his brother agency at the NSF. And what we do is we start with you guys with a napkin, with an idea, and we take you through a series of steps that's fairly well programmed. And the first objective is to get you into I-Corps, which is an NSF program. The reason is it teaches you business language, business thinking, and it improves your grant writing ability. Okay. After I-Corps, we go and do things that are called SBIRs and STTRs, which are also available at NIH. It's more money. It's up to like $1.5 million. And that's real capital to develop your idea and to start commercializing it, and to build prototypes, to do all the things that you guys have studied. And all of that is what I do. I have 3 postdocs that work for me to support it. And we're looking into an entrepreneur in residence. So we could end up with a faculty of 5 or a group of 5 to support you guys so you get to be better friends with our visitor, all right? Okay, Danny, what's the next slide? Okay, you're up.
Thanks, Bob. There's some seats here, by the way, for those of you in the back. And we also don't bite in case anyone comes in.
Danny does the empathy if you're confused.
All right, so I think one of the biggest things we want to always talk about is where we have to understand what's happened in the past to recognize patterns, to see where we're living in right now, and what are the opportunities, right? So let's go really quick through the different industrial revolutions. First industrial revolution, late 1700s. What happened in the late 1700s? What was invented? Everybody get up. Everybody get up. Yep. Come on. Everybody get up. Super exciting. It's 9:20 in the morning. All right. So if you're able to get up, please get up. And I want you all to take a big breath. Let it go. I don't hear it. And move your wrists. And move them the other way. And then jiggle your knees. And say that today's gonna be a great day. Today's gonna be a great day. Great day. Super pumped. You're gonna have posters. All right, go. Okay. All right. So what happened in the late 1700s?
Steam engine.
Steam engine. Thanks for reading. And what happened with the steam engine?
It revolutionized the industry.
How? How?
Look, no longer we have to depend on animals. We have machines.
So what was discovered that what was discovered that gave us the steam? What was discovered? I mean, something in the ground. Coal. Where was that discovered?
England.
England. And what happened right after the 1700s, where steam engines start? We have a huge expansion of railroads. Hits the steel industry, and we have a huge wave of colonization from the British Empire, right? Then what happens in the 1800s? We fast forward to the Second Industrial Revolution. Yes. And then? So electricity. And what happens with electricity? Manufacturing, factories. Big automation, we have a rise in capitalism, a lot of productivity. So every time we have a new energy form, we have a rise in production. Let's fast forward to the Third Industrial Revolution. And we're gonna get deeper into each of these because there's patterns in each of them. What happened in the Third Industrial Revolution? What's the new energy? What's the new form of energy? What is it? Nuclear.
Oh, right.
Nuclear. And then we also have
Come on, people.
Right.
Automated production.
yes, automated production. But it also now that you know how we talked about colonization? What also happens right after nuclear? In
Space travel.
and Cold War, right? We're during that time for the race of nuclear, right? So now let's fast forward to now the Fourth Industrial Revolution. The cyber physics.
What's the form of energy?
Yes.
Renewable.
Okay.
Solar.
Solar maybe is gonna be the low-cost form.
Wind.
Wind.
So renewable, right?
That's.
So now let's break down what is important to understand about these industrial revolutions. It's the patterns in them. So every industrial revolution has a change. It has a new form of energy, which is what we got in the first slide. Oh, okay. The first slide. The second one is redefines the way information is created or shared. First industrial revolution. What's a new form of information being shared? So this is what 1770s, 1790s.
1770s. What happened in the 1770s? Where did we have a revolution? Where did we have a revolution before America?
France.
France. What launched the French Revolution?
Information, of sharing information.
Telegraph.
That was actually also during the first industrial revolution. The telegraph leads to telephone, the radio, and the telephone,
And movies.
right? And we start having, yes, we have started. And what happened in the third industrial revolution?
You guys almost lived through this one. Almost.
So now we have ever faster exchange of information, and the faster and decreasing cost of information also decreases the value, the cost of exchanging value, right? So this is every time it gets more cost effective, and the transitions are faster. So what would we say is the new form of exchanging information? No, think deeper, think more critically. Think of the technologies available today. So we talked about renewable energy. What do you believe and is the new form of exchanging information?
Media manipulation.
What? Okay.
Yeah, we could do that back in the
Well, in
70s.
general.
But now you
like
can do it
apps.
person to person.
Personalized media manipulation.
So we could say that maybe blockchain is a new way of exchanging information, right?
How many people know what blockchain is?
It's a great way to.
At least you guys are honest.
Yes.
Usually when I ask like how many people know what artificial intelligence is, everybody raises their hand. And then I say, who can define artificial intelligence? Every hand comes down. All right, but you guys are more honest brokers.
One of the key things about blockchain, and so we don't get that into it, is one of the values of it is that it's allowing us to decentralize. Okay, so normally one person or one company owns all of the data source or all of the data set or all of the node for exchanging information, and blockchain is allowing us to decentralize that. So maybe it's democratic.
I'm sorry, I just don't understand. Like, it's decentralizing by decentralization.
Okay, so we have, let's say Facebook. Who right now gets to dictate who's our identity online?
Oh, it's not.
Really?
No, basically.
Facebook, right? Because anytime we sign in or anybody on the online world, it's Facebook, right? Why? Because Facebook hosts all the information of people's identity online, and we're the first to market that really scaled at that level. But if we were able to break that silo of information, that data silo, and we distribute it across every computer, and no one would really own that data set of who is, what's your name? Diego. Who is Diego? Is Diego Diego or is Diego Pedro? Is Facebook dictates that right now, which is it's a battle, but that's why we're talking about the patterns, because it's not set in stone. And we have to understand that there's changes every time. And that's the exciting part of living where we are today. As long as we can recognize that if we take action into it, we get to dictate where that goes. So, social movements, so we can pass on to the next phase of this. Social movements. Every industrial revolution gives us different social movements. So let's go into women's movements. After the first industrial revolution, where we had more trains and there was more freedom of movement of women weren't that afraid of like walking outside of the villages and getting raped, right, or killed. There was more freedom of movement around the world for women, or at least in the United States, and that started to plant seeds for us to have the suffrage movement during the first industrial revolution. In the second industrial revolution, so the right to vote. And the right to vote was all about, having a voice in the political system. And then we have the telegraph and the radio, faster exchange of information, people are able to mobilize. So now we go to the third industrial revolution. We have sexual freedom for women. What also happened during 1969, socially in the United States? Civil action right of 1969. Right? The youth through collective movement was able to mobilize and give us the civil action of 1969. And so what are the social movements that we're looking at today, even for women? Right? And what are the social movements that we're starting to see today around the world? All right, so we are going to go into 5 different technologies that make up the fourth industrial revolution, and that really have a huge opportunity. One of the key things is to understand that data is the new dollar. So the first one is artificial intelligence, and we're gonna just to understand. We're not gonna dive deep into each of these technologies. I want you all just to have an understanding of what the opportunity lies behind them. But at high level, artificial intelligence is the technique which enables machines to mimic human behavior, and then we start getting deeper into a more robust and complex science. Then we have gaming. Gaming is really interesting because it's not about just World of Warcraft. It's more these graphics. What does that look like for being able to run graphics for the way people see or training doctors? And gaming combined with VR and AR, which is our third technology. Now we start seeing way more realistic simulations, right? We're starting to see how the military uses augmented and VR to train. What does that look like with how medical students are being trained or paramedics? So if we start combining these technologies, there's huge opportunity behind them. And then we have our fifth, which is cyber physical systems. So we're really connecting where the physical with the digital world. An example of that might be the pacemaker. So we have the physical heart, the pacemaker, that's your interface, and then you have electronics or digital, right? So how are we connecting that, right? We with IoT as well. Underneath it.
If you think about biomedical engineering and you think about the 5 technologies that we say are going to be the principal forces that are going to drive the beginning of the 4th Industrial Revolution, give me an example of either biomedical or healthcare and how it applies to each one of the 5. So how are we going to see artificial intelligence used for healthcare, or for biomedical research, or sorry?
Diagnosis.
Give me a more specific example.
Let's say identifying some disease from a MRI or CT scan.
All right, so we use AI to sort through digital images for better diagnosis, right? This is why you didn't go to medical school. We're going to replace the doctors. Go.
So when you're doing untargeted approaches using LCMS platforms, you can identify different biomarkers to diagnose TBI or any others.
Right. Yeah, the last talk I gave at FIU was a talk on artificial intelligence and biomolecular science. And I would argue that what you're talking about is what I spent the whole talk circling, right? Biology is very combinatorial. Artificial intelligence works really well with combinatorial problems. It's not surprising that people are saying that biology is going to become an engineering science. That'd be pretty cool, you know? Go from natural science to an engineering science. Okay, the second one was, what's our second one? Anybody remember? Virtual reality. How are we going to use virtual reality in healthcare or biomedical?
Doctors could use it for surgical pre-planning.
Right, or training, assuming we still have doctors. All right. Cyber physical systems, how does it apply to your field? I'll give you a hint, I have a pacemaker.
So any implantable, basically, that you can
Yeah.
monitor.
She's been hacked, all right, but somebody else.
You.
Neural interfaces.
So, say it again?
Neural interfaces. So interface for example, a prosthesis and its motor control and to the person,
All right.
to their intention of movement, and what the interaction of the hand to the perception of sensations.
So you must be in her lab. It's a very good place to be. I know a woman who was an undergraduate BME person who now works at the Media Lab at MIT on the prosthetics project. And the reason she got the job, she had 4 years in the professor's lab. And she's really smart, but that's another thing. All right. What else have we got? We did cyber, we did VR. How are we going to apply gaming to medicine, medical, physical therapy? Could be. That's a lot of people are in the space of trying to use artificial intelligence and physical therapy and improve it. And maybe with the greater power of the rendering engines in gaming, you can take those engines and use them for better outcomes in physical therapy. It's the engines in the gaming. It's not the part that everybody likes.
I know there's a game currently available. It's a puzzle game essentially, which allows you to protein fold for scientists.
Right.
So basically, it leverages the fact that gamers are obsessive and they love puzzles, and it also leverages the fact that protein folding is near impossible to do with computational purposes right now.
Right.
But if you throw a bunch of gamers at it, they will find solutions that you would never think of.
I think that's a great example. All right. Because it's so totally uncharacteristic of what we all thought when we first came to graduate school, right? And now this kind of thinking, it looks like it's the mainstream. all you had to do was throw in the word personalized, and you would have had the trifecta of the trends in healthcare and medicine and biomolecular sciences, right? All right, how are we going to use the blockchain? Danny gave you the answer. Go ahead.
You want to decentralize everything. So if a blockchain is like a group of people where 10 of them have series of ledgers, you use that to basically encrypt your medical records.
Right. Okay. Yes. Blockchain is going to become, hopefully, a repository for personal health data. I think I've seen 5 projects from people trying to do that. None of these people have the chutzpah to get it done, but somebody like Google's going to figure it out, or you could figure it out. Maybe our visitor will give you a grant to figure that out. All right, because they're very big in the database creation support initiative of the federal government. So it's not so far-fetched that we're going to figure out how to do this for health data, although it's complicated, right? But the fact is, without a lot of thought, we took the 5 technologies that we think are going to characterize the Industrial Revolution, the 4th Industrial Revolution. Every one of them applies to what you folks do. And when you layer on energy and information and then the 5 technologies, you've got a really good environment to see opportunity based on insights and then to advance it to the markets through commercialization. That's exciting to me. And anybody that wants to have serious talks about that, we have all kinds of time. People are from India. Nobody. Okay, so you all have the same advantage. You don't know India. Imagine that we're putting in the field in rural India with very, very poor people a telemedicine facility where you can go in, do a test, the results are sent to doctors in a big city in India, and the results come back to the telemedicine facility, okay? That's the background. Now, in entrepreneurship, there's probably 3 really good ways to understand it, okay? One way to understand entrepreneurship is to think about it as explore and exploit. And if you don't recognize that almost every natural system behaves according to explore and exploit, you're supposed to start spinning the wheels when you realize that entrepreneurship behaves like a natural system. Okay, why does that happen? Because of course people are natural systems. But technology revolutions, scientific revolutions with Thomas Kuhn, right? They all behave the same way as entrepreneurship. Explore, exploit. So that's one way to think about entrepreneurship. Next way to think about entrepreneurship is create value for the customer and then decide how much you want to capture. And depending on how much you capture, you're either a traditional entrepreneur or a social entrepreneur. And the third way to think about entrepreneurship is to think about it in terms of problem, solution, and scale. So what's the problem? How are we going to solve it? And then with that solution, how do we have big impact helping people? Okay? Now, for each of those 3 pieces, problem, solution, and scaling, there's always at least one key assumption that you have to get right for your entrepreneurship to succeed. You understand what I'm saying? Think about the problem, think about telemedicine, rural India, poor people, right? What's the assumption about the problem that the people have in rural India with respect to health? What's the assumption you've got to be right about? Well, I'm going to give you guys like 10 minutes to get in groups because I want you to come back and tell me what's the key assumption about the problem, what's the key assumption about the solution, what do we have to get right about the solution for it to work, and then thirdly, what's the key assumption that we have to be right about in order to scale. And if we had more time, I'd explain to you how assumptions and risk go together. And one of the most famous venture capitalists in the United States, a guy named Mark Andreessen, says that all entrepreneurship is validating assumptions. Okay, so if we can highlight the key assumptions around problem solution and scaling, we're highlighting the risks, we're highlighting what we have to validate, and that's how you think about progressing your commercialization. So break up into groups of 4, and at 9:50, we're going to debrief. You got to come back with an assumption about problem, solution, and scale. If you have a question, we're happy to help. Remember, poor people, rural India.
I'm already guessing that you but Social Security gave us a flag that gave us people actually have access. The problem is, I have to we want to do Right, so I guess that would be the problem. Yeah, the problem, right, are you going to get supplied? Right, everybody uses so many. Right, because that's actually like something that I brought about is like let's say a lot of like countries in the population
So you're saying like telemedicine? So there's no treatment there, it's like diagnosis. You know, it's funny, I've used this example maybe 10 times. Nobody's ever asked me about treatment. What's the point of this? You diagnose it, there's no reason.
Right. It's a very small community. There's a lot of very small communities. There's a lot of small communities very far from each other. Again, there's like accessibility in place. And as a right. Crazy about my project, which is developing a software to analyze digitally recorded breakdowns to identify these. I'm sure it will be, but can't take that access out. The key assumption about this is like it would be very low percentage. Right. Because it is very
I think
there's a lot they cannot afford. Let's put it that way. The assumption is that there's not accessible, right? Whether it's on or the fact that it's too far, because again, maybe it's very far.
Alright. Daniela. Alright. We need to debrief this. So, we have an assumption related to the problem that we have to understand. So what did you guys decide was the assumption about the problem? What's the key assumption?
That they'll value traditional Western medicine over the culturally relevant medicine they practice currently.
I'm going to say no. After I say no, at the end of the problem, you can come back and say we said the same thing. So that they have available, let's call it modern healthcare. Okay? Because it turns out that these people in rural India are using what I call witch doctors for medical care. All right? And the point to take away from this particular assumption is that whenever you do social entrepreneurship, there's always a much higher requirement to educate the customer, the user, whatever you want to call them, the patient, okay? So remember, you do social entrepreneurship, you're most likely doing it with people that suffer from what I call asymmetry of information. They don't have good information, and you've got to provide it. Okay. Now, solution. What's the key assumption about the solution? Did anybody get to solution?
Accessibility.
Anybody know how to spell solution?
Have someone back.
That your target is willing and able to do a solution.
What do you mean by do?
If your solution involves this factor, maybe a phone, they need to have a phone.
All right. I would say you're right. All right. And I expect you Monday morning to be down at StartUP FIU, right? The fact is, trust is the most fundamental emotion that we have. And eventually, somebody in biomimicry is going to document that to the nth degree. I think we're at N-1 degrees now. All right. Trust is the most fundamental emotion. If you can't establish trust, you'll never get your solution implemented effectively. And so what you've got to do is you've got to work to foster trust so that they will switch from witch doctors to telemedicine, right? Anybody notice a pattern here between educating and establishing? Anybody see what the pattern is between?
You have to trust the people who educate.
I'm sorry?
You have to trust your educators.
Trust your
You
educators.
have to trust the person that's educating you, because if you think that the guy is lying, then regardless of what he
Well,
says, it
yeah.
might be the truth or not.
Right, but you're not, except I never would say that you're designing for it.
Right.
I would say you're solving the
You're
problem
solving-
for the people, right? And the point here, and this gentleman with the full beard made the point when I was walking around. Yes, raise your hand proudly. All right? He said to me that the challenge he was having with the exercise was trying to integrate sort of the humanity and the patient, or the unit engineers get over, and average engineers maybe don't even know it's a conflict. Okay, when you think about companies like Hewlett-Packard and all the great products that they made, yeah, they were pretty good engineers, but they were much, much better at understanding the other federal grants. Very first question is, what's your problem? 99% of the time, we get this technical explanation that doesn't involve any humanity. All right, and then we nicely and friendly roll back the conversation to who are we trying to help? What's the problem we're trying to solve? Then we talk about how are you solving, okay? So remember, entrepreneurship is about bridging the humanity and the customer and the user with the good engineering training that you're getting. But if you're interested in being a great engineer or having great impact, you've got to put them together. Now, just for fun, what's the key assumption in scaling?
You'll be able to make money on it.
I'm sorry? But I would say that's a good starting point, but you ought to drill down and find out where the real problem is. You know that they were so expensive? That's what you would need to do too, right? Is break down something. And you know what's interesting is it's almost always energy, matter, or information, right? Surprising how that physics shows up over and over again.
So even though India is one country, it's far from like monolithic. There's different languages, cultural sensitivities. All that has to be changed.
The governor was complaining that he had 60 indigenous languages. And then he said there were 300 indigenous languages in Mexico. And I thought, my God, how do you deal with all those indigenous languages? And then I was talking to an Indian student. And they told me that there's 900 indigenous languages in India. I don't know if that's true, but I'm sure it's a very, very big number. And I do think language is probably going to be a problem. Means you need doctors that speak 900 languages. Sounds like a challenge, all right? Social impact. And for example, at the NSF, they publicly declare they're looking for, paradigm shifts in tech standard. I'm sure the NSF has their way of making exactly the same point, all right? And so what we've got to do is we've got to come up to that standard if we want to engage with people like this. And that's what we're trying to help you do at StartUP. Who's got a question? Miss.
We briefly talked about the incubator program.
What is an incubator? What's your answer to what's an incubator? You've been sitting here dutifully being quiet.
Well, it comes down to helping you go from idea or the stage that you're in and giving you the right resources, exposing you to right mental models or learnings to get you to go from where you are today to the next step. An incubator at the end of the day is a safe environment for you to test and validate your key assumptions and progress your startup or venture. At StartUP FIU, we have different programs. So Bob's commercializing research is a specific timeline where you are exposed to lectures, workshops, and then there's for programs I run, there's programs that I run that are, do you have a passion and you kind of don't even know where to start? Like some people go to him. Does that answer your question? Yes. Yeah.
You're going from an idea, like Danny said, right? You're approaching proof of concept. I do the programs with people I meet every week if they want to meet every week. Most people come either weekly or every 2 weeks, and we advance it largely on your schedule, okay? We agree what the objective is, but we approach it on your schedule. Okay? And we're talking with Lydia Coase, the Assistant Dean of the Graduate School, that I'm just formalizing something kind of at scale for graduate students.
I had 2 people ask me something when I was walking around, which I realized we didn't communicate. So StartUP FIU is located right now at MMC at the Mark building. So it's literally next to Baby Cafe on the 3rd floor. You're welcome to camp out of there to work, to host meetings, but we also invite you to the different tiers of workshops. Bob hosts these things on Wednesday called Hack.
Anybody? Nearly perfect time.
Good. Yeah, like we say so.
All right.
Thank you
Thanks,
very
everybody.
much.
So, guys, take a little break, and at 10:30 we start the fourth session and the content. The judges are going to be wearing something like this. Yes. So when you see a judge, stop what you're explaining because they have limited time, and just focus on that judge. Okay? They need to finish in 2 hours. They will be working